Shall we go ahead and get started, Varun?
Yeah. Would you like to kick off?
Yeah, sure. So first off, everyone, thank you for joining our session here with Varun and myself on digital health accelerators. To quickly introduce myself, my name is Matt Purdy. I am the startup program manager here at Mass Challenge for our health tech program. So we'll definitely be diving into this session more, but definitely want to make this as interactive as possible. So if anyone has any questions, by all means, feel free to ask whenever. Varun, you want to give maybe a quick intro as well?
Yeah. I'm part of J&J Innovation, Johnson & Johnson Innovation, and I'm responsible for the partnerships that Johnson & Johnson Innovation does in digital health and data sciences. But part of J&J Innovation is an accelerator called JLabs. And I'm happy to share today a little bit about JLabs and just talk about the journey that some of our companies go through at JLabs and maybe answer questions on just, the sort of different experiences that you can look for as you're thinking of accelerators for yourselves or for your companies.
Great. I guess maybe to just kick off the conversation, how have people looked at accelerator programs kind of existingly to date? What have you heard of Mass Challenge or J&J or any other programs, and how have you perceived accelerators?
Hi, so my name is Mateus Tura. I'm currently the founder and CEO of a very early stage startup, and I'm actually participating in Mass Challenge Boston right now. Yes, I'm fond of and know the Mass Challenge atmosphere or space decently well. Have done some of the research in Mass Challenge from the health tech perspective as well, and that's sort of what brings me here today, and specifically this group as well. And the specific area that my company is focused on is creating wearable technology that analyzes the way that an athlete moves to analyze their form and efficiency to help give them feedback on how to move better. So that's the space that I'm currently occupying, and of course have vested interest in mass tech or mass challenge health as well.
Cool to hear that we have a Mass Challenge participant. Nice to meet you, Matthias.
Likewise.
Any other hands raised for just experiences with accelerators in the Boston area, or interested? Maybe let's start here. We're a small group. Why don't we do a quick round of intro so that we can sort of get a sense of the room? Matthias, you helped to start off. So maybe J.R. Rodriguez, would you like to go next, please?
Sure. By the way, Matt, I'm actually a Mass Challenge expert. I judged first round. I'm judging second round. So, small world. I am.
The big question is I hope you reviewed Matthias's application then.
I did not.
Very good.
I did not. And I'm a VP with Geisel Software, a Worcester-based custom software engineering house that does a lot of AI and machine learning and robotics and medical equipment. And we actually get involved with small startups to help them accelerate the development of their product.
Cool, thank you. Michael, would you like to go next?
Sure, Michael Arnold Magis. I'm faculty in the design program at Northeastern, and had a previous career where I was a partner in 2 different startups and participated in a third. We were never part of an accelerator, so we went it alone every time, but learned a lot by doing that. I'm also interested in how design might be approached. I'm a designer by trade, and interested in how design might be supported through evidence to provide better outcomes, especially for behavior change situations.
Thanks, Michael. And just so that I remember the question, is it in the context of medical technology? Is it in the context of is general design, like what sort of, is it, what sort of
Oh yeah,
initial
that's a good visual design for software.
visual
So
design for software?
interaction design predominantly. My background's in like UI, UX, optimizing interfaces, usually to sell products.
Yeah, we can touch on that. Thank you. Mary Rose, would you like to go next?
Sure thing. So my name is Mary Rose, and I'm a first-year nursing student. I'm located in Boston. This past weekend, I participated in the Nurse Hack for Health event that's sponsored by Johnson & Johnson, and our team, I think our team came up with a very innovative idea that could address the disparities within the nursing and also health professions in terms of the lack of diversity and representation of underrepresented, at this point, students. We're aiming to recruit more high school as well as middle school students into the health professions pipeline. So I'm just glad to be here, and I want to learn more about accelerator challenges and how I can get involved and bring this idea to life.
Awesome. Thank you. Raymond, would you like to go next?
Hi, yes. Hello, everyone. My name is Raymond Fu. I'm a AI professor at Northeastern. I'm also a serial entrepreneur. So we have been in Mass Challenger multiple times for my former 2 startups. And I have a new startup right now running for digital health using AI technology. And this one is actually also in the Mass Challenge. We're going to present next week. So we are also interested in other local accelerators for our new startups. Thank you.
Cynthia.
Hello, everyone. My name is Cynthia. I am also a nurse. I'm a nurse at Tufts Medical Center in the cardiothoracic ICU unit. I am also a second-year PhD student in the Northeastern Nursing Program here. I am recently joined on as a venture and health science entrepreneur group here at Northeastern. So I'm excited to be in this space and also know that just nursing in general is very underrepresented in these spaces of innovation, although we are unofficially innovators. So I'm really excited to, have that representation, but also connect with people who are also in that space and, have that expertise to kind of guide the direction of my venture, which is community health worker-led health support group that would be able to integrate community health workers into our fragmented healthcare system. So I'm very excited, happy to see everyone. Thank you.
Thank you, Cynthia. Sakina, if I mention, and forgive me if I'm mispronouncing your name. We cannot hear you, Sakina. Let's try one more time.
Hello?
There we are. Okay.
Oh, hi. I was just saying, I'm just here to record the session, actually.
Okay. All right. Thank you for joining us.
Yes, thank
Rhonda.
Hi, everyone. I'm Rhonda Mans. I also, I'm a registered nurse as well. Also a board member on Sunseal, who recently, partnered with J&J for the nurse hackathons, which we attended this past weekend. It was phenomenal. Thank you for your sponsorship. And then in addition, I am a Northeastern HSC mentor for others in entrepreneurship. And I'm really excited to be in this space because as Cynthia mentioned, nurses have many ideas, but oftentimes I think the disconnect is where do you go next? And so I've heard about accelerators, but I'm not really sure about the formal process. But all I know is that when people go through them, they're very successful. So I'm here to learn and just, meet everybody else. Thank you.
Thank you. So it sounds like first of all, we have an awesome group, and sounds like we have maybe some questions that are going to direct towards how do we be part of accelerators? Mary Rose, Cynthia, Rhonda, Matthias, I think there are questions on how do we be part of accelerators? When should we think about accelerators? What can we get out of an accelerator? So on and so forth. And so maybe Matt and I can sort of index those questions first. Sounds like we have questions also on designing products and how sort of, from a software perspective, can we gain a certain collective benefit out of or value add from such accelerators in the field of UX and and cognitive, and I'd maybe say behavioral science as it relates to software design. And I think those are the two areas of questions. And then Raymond's world of AI is a very deep world of AI, and we'll try and touch a little bit about that. But have I maybe summarized what are the, if you will, the targets for maybe the first half of this conversation? Fantastic. Matt, would you like to kick off? And maybe you and I can walk through what is an accelerator, why should anyone care, how does Mass Challenge solve for this, and what should someone think about as they are thinking of their ideas at such an early stage, and how do they think of those early stage ideas as it relates to the program you run at Mass Challenge, which is the health tech program?
Yeah, no, happy to start there. I think to take a step back even away from Mass Challenge and just think about what is an accelerator. What I have learned through my experiences with Mass Challenge Health Tech, mind you, I've gone through now 3 program cycles. The idea of an accelerator is that we, within Mass Challenge, surround you with a community that provides you with resources that you can pick and choose to interact with, but ultimately that are there to help you. If I had to quote Mass Challenge's mission, our mission is to help entrepreneurs win. So we want to do this, and we've seen this done through community convening. Now, I'd say kind of the root of the word accelerate is how can we get you from point A to point B in a much more abbreviated time. Usually for us, it's about a 5-month window or 5-month journey, I'll call it. Just one kind of differentiator between Mass Challenge Health Tech, the program that I oversee, and maybe some of the programs that you folks have engaged with, Mateus and Raymond in particular. We're a global network of accelerator programs. So geographically, we have programs all throughout the world: Switzerland, Israel, Mexico. We have a couple programs in Texas, and then we have our main program in Boston. And those industry agnostic programs are more tailored towards entrepreneurs that are in what we call the discovery stage. So the discovery stage is when you have an idea and you are looking to further develop or further understand that idea. So these programs are really focused on equipping the entrepreneur with knowledge. For me and myself and our team at Mass Challenge Health Tech, our program operates a little bit differently, where our goal is to connect entrepreneurs with enterprises within healthcare within the Boston ecosystem. So that program, Mass Challenge Health Tech, is tailored towards helping you obtain pilots and finding ways that we can help you scale and validate your solution. So a little bit of a differentiator, happy to talk about kind of both, but to kind of just kick it off, really, I think to take to full circle here, accelerators exist in all span of a startup's life cycle. So whether you're at the ideation stage or whether you are looking to really scale your business, there are programs out there that ultimately can provide resources that you can take advantage of.
Thanks so much, Matt. And that's a perfect segue into what JLabs is and what is an accelerator and an incubator from the perspective of Johnson & Johnson Innovation JLabs. As Matt mentioned, there are accelerators for entrepreneurs that are very early stage. There are accelerators for those that have ideated, have matured, but they are looking for that next big milestone that they need help with. And think of JLabs as sort of what is an accelerator incubator for companies that have crossed that milestone, but they are now trying to scale beyond. They want to walk out of an accelerator and never call themselves a startup again, but as an established organization. JLabs is sort of, I would say, a mid-stage. We invite companies that are Series A and above. And these companies are no strings attached to Johnson & Johnson. The mission of JLabs is to provide an environment through which companies can work on their science and technology and de-risk their science and technology at a scale that is maybe more rapid than what they can do if they were on their own. In the context of healthcare, I think we are all aware of this. The cost of scaling a business is very high. To have the ability to evaluate science, technology, and take it through a process of validation. And I mean validation, it is whether, do I know my customer? Do I know my product? Do I know if my product works? Do I know who my product works for? Why, when, how? There's that whole series of validation that is expensive. For biotech companies, it's obscenely expensive to have a wet lab. And JLabs actually started with just that to say, can we abstract some of those costs from a startup to enable them to spend their money in just getting the science right, in getting the tech right. And 7 years through our journey, we've not just been a wet lab space, we're also a space for health tech companies, for medical device companies, for consumer health companies that sort of benefit through a few tools. One is, of course, infrastructure. To be able to have a workspace, a WeWork for healthcare companies, and also a wet lab for healthcare companies, if they need one, is an advantage that offsets the need to scale. Today, I have 5 employees. Next month, I want 7. 3 months after, I'm going to just be 2 employees. You can dial up and dial down as you like. That's the point one. Point two, we provide access to knowledge that Johnson & Johnson has. Not just Johnson & Johnson, we bring knowledge from other parts of the ecosystem as well. We have key opinion leaders that spend so much time at JLabs through our events, through the quickfire challenges, the nurse hack, the hacking, the hackathons and the quickfire challenges that you hear about are all part of JLabs. They're all actually part of my organization, with the intention of inviting not just entrepreneurs, but ideas that can actually enrich the community. The third is access to a venture capital network. And these are, by the way, common things. Mass Challenge has such a rich community for all of these things as well. JLabs brings its own set of venture capitalists. And I will add by saying that there is nothing more powerful than being in the same room as another company that is probably having similar problems as you. And JLabs today has around a network of about 700 companies that are currently part of JLabs or that have graduated JLabs, over 13 sites globally: Shanghai, Belgium, the United States, all parts, Canada. We have JLabs everywhere. And what we try to bring through that is a global network of knowledge and of experience that you can leverage as a company that you choose to be. Now, another reason why companies look for accelerators tied to companies like J&J is because they recognize that companies like J&J are critical to their business. They have either a molecular asset or they have data science that eventually is valuable to a pharma company like Johnson & Johnson or a Pfizer or a Novartis. So this goes into the next question of, what sort of accelerator do I need? What is the strategy to think about the accelerator I need? Am I in a phase where I'm still ideating? And I need a program that can give me a framework to make that idea into company. Now, that is the feasibility blueprint stage. And do I need that? And if I need that, there's a set of accelerators to go to. Am I a company that has a validated, not a validated, but has a reasonable sense of my vision as a company, but I'm trying to get to a point where that company is investment worthy, meaning I want to be able to, if I need to, convince venture capitalists to put money in it? Or am I in a stage where venture capitalists have put money in it, but I need to realize the investment that companies want, that venture capitalists want to put money in it? This is question number one. And so that question number one has to be answered. Question number two is, what makes me successful? Is it the capital? Where are we trying to compensate or complement the strength of your team? Is it that we don't have knowledge in how to scale a tech company? So let's go to tech accelerators like Techstars or Y Combinator. Or are we trying to learn more about the healthcare market and we don't have knowledge on the healthcare market? Mass Challenge Health Tech. Plug and Play, if they invest in you, they have a phenomenal healthcare program. JLabs, am I looking for just all I need is just lab space? Or all I need is just office space? You don't need an accelerator, go to WeWork. Or you could go to lab space, you could go to a JLabs, or you could go to Lab Central that is down the street in Central Square. Like, there are so many options. And so there's like this checklist that we can maybe further unpack, if you like, on how you answer the question, do I need an accelerator? And if yes, when? And if yes, how? Matt, anything to add to that? Maybe we'll ask for questions.
No, I'm great to open it up. I think the one thing I would add is that after you go through that investor readiness, where kind of health tech fits in, or just where other programs like health tech, like plug and play, is that enterprise readiness. So once I have some fundraising, once I validated, how can I be prepared to work with enterprises? So really, there's a wide range, and where incubators exist at the incubation of idea, accelerators are there to accelerate your business. So I definitely want to open it up to questions, just because I know Varun and I have been speaking for a little bit. But any thoughts on just kind of what we've talked about thus far?
Yeah, thank you guys for just giving us the groundwork of when and where, and things to consider when signing up for different accelerators. I had a question for Matt, like, because you had mentioned that the way that Mass Challenge Health works is that you help startups partner up with different organizations in the Mass ecosystem, and I was curious: are companies, startups, required to have already made those partnerships before coming into Mass Challenge Health, or do you guys help with that process?
Yeah, so it's yes and no. So first off, so when we start our program cycle, and this kind of is similar for other programs that kind of have a similar partner model. Usually at the beginning, when decisions and when judging is being made to initially create the cohort, the partner will make the decision or believe that there's room to potentially work through the lens of the program. So at the start of the health tech program, a startup can receive different offers, whether that be something that's more of an advisory support or a co-development. So that's actually saying, you know what, we want to help co-develop your solution. It could be maybe some sort of pilot right out of the gate. Usually that's rare in our program, but it is possible. Or really, we want the partner to feel that there's a sense that ultimately they can relate to the startup at whatever position they are. So if they're looking to just simply understand, there might be room for an offer there. So I guess to summarize and to answer your question directly, it really depends. But ultimately, going through the program and being accepted is a way to enable initial conversations for you to then build the relationship within the program.
Thank you. So basically, just like you open up that door for startups to make those strategic partnerships.
Correct.
Thank you.
Any other questions?
I think, Varun, I'll ask you a question.
Sure.
So, and just for kind of conversation, I know you started to touch on kind of the different resources that programs offer, and this is kind of maybe the what of the program, or maybe the why of the program. How have you seen entrepreneurs to not only assess different accelerators, but how entrepreneurs have been able to successfully really take advantage of the offerings at like a J Labs?
Great question. So we've seen a few of those successes. Companies come in to J Labs at a stage of good funding, and maybe one example of a company, I'll give you two examples actually. One where they came because of their success was driven by the fact that there was mutual interest between J&J and this company to sort of further evolve their interests. And we work with that. They're in the space of microbiome research. Had some phenomenal thought processes on how one could study baby health through microbiome. And we partnered with them to leverage their AI to sort of learn more about the space of microbiome and its impact to consumer health. This company, as they came in, were probably a very small group, but through understanding in these partnerships what could actually be, their customers could potentially be J&J's, I think they were able to use J Labs to scale, find better talent, just to really build, a robust team. In the end of the day, it's the people. And, when you're in a community like this, finding valuable people just becomes that much easier. And, they continue to work with Johnson & Johnson in powerful ways. Some of our companies have come in as very small Series A, Series B companies, and in 2 years have exited with a larger significant. Some of our companies have gone to be acquired by large pharma, biotech. They've gone to maybe go down to, I think one has gone through IPO, but essentially they've used JLabs as a way. JLabs provides a certain, what we've observed, it tells investors and customers and partners in the ecosystem that this company is past a filter. It's like saying I went to Harvard. We're proud to say that JLabs is one of those incubators where a startup can be recognized for passing a filter that was set up by Johnson. And it's not an easy filter. We have a fairly elaborate selection process that helps us be choiceful and responsible for the companies that come in. So that's maybe my response.